Google representatives came. Basically what they said at that time was, hey, we feel you, but we built a playground. You guys play badly on it. That's not our problem. Next thing you know, we've got a New York Times expose on people dying, and Google is letting them die. And so all of a sudden, then we get a call, and literally get a call from Google that said, would you like to come to the campus? We could use your help developing a system of checks and balances to make sure that this works. So I was kind of excited to go to the Google campus because like magical place. It's not magical. You can take your dog to work there, but you don't ever get to go home. About a month later, I got a call from a reporter at the Times of London. We heard you got AdWords shut down. How'd you do that? And I said, well, I did that single-handedly, without anybody's help. I heard somebody say to one of our staff members recently when talking about having diversity within the organization, this is a quote, we don't have to do that anymore.
Welcome back to MasterMined. I'm your host, Mark Scrivener, and as always, I'm joined by my fabulous co-host, Jeff Skillen. Welcome to the show, man.
Mark, it's a glorious day, and this is going to be a great episode. Good to see you.
You're right, man. And Lee, man, thanks for joining the show. Lee Pepper, author, speaker, just you do so much. Lee, it's great to have you here.
And Ice Barcelona drinker.
You did, yeah.
Yeah, I'm going to have to ask our guests when they went down to Dose if they tried the Barcelona iced coffee drink.
We did not. I was pretty coffeeed up by that point. But now that you've said that, maybe I get
Mark
back.
can tell you Lee's coffeeed up this morning because he saw my drink.
Yeah. Well, we're really lucky today to have Marvin Ventrell, the CEO of NAATP, and many other things. But NAATP is the place where a lot of decisions get made in this space. And we're really excited and lucky to have you on the show today. And we're also looking forward to being down at NAATP Nationals 2026 with you in about a month or so.
Yeah, in 3 weeks. Well, thanks for having me. I'm excited about this, too. And I love how you said this is where the decisions are made. That's really our job in this still growing field, still fairly young field, is to create a place where the best leadership, the best providers, the best thinkers, and the good guys are found and make the decisions that lead the field.
Yeah, well, Marvin, I know you've had an illustrious journey, but what drew you to NAATP?
Well, you think you have things planned out in your life and in your career, and you find out that's not quite how it works. That something else is sort of directing you, and that certainly was the case with me. So I've had a long journey. I'm a trial lawyer. I went to law school right after college. I was practicing law when I was 24. And so that, from there to where I am now, you couldn't really draw a straight line. I wouldn't have in a million years have imagined it. But as I look back now and reflecting on a 35, nearly 40-year career, I see a golden thread that really ties it all together. Not that I had the wisdom to plan that, but I think if I did something good, I paid attention to the signs the universe was providing and tried to do the right things, tried to do things that felt like they fit, and then correct my mess ups along the way. And so ultimately, I would not have been in this position but for my own recovery from addiction. So. I'm 18 years clean and sober. I went to treatment, 18, 19 years ago. And, you're a guy sitting in treatment. Life's taken a bad turn. I wasn't well at that point. I'd had a good career, but things kind of fell apart. And, there's a couple ways to become an alcoholic or someone with a substance use disorder. One is you're born that way and you drink or use, and the other is you work really hard at it. And I'm the work really hard at it guy, right? And so ultimately, the skills that hopefully I acquired and was trained for positioned me 10 years ago to take this position as CEO of NAATP, and I never would have planned it or predicted it, but I'm the luckiest guy on earth to have this job.
Marvin, first of all, I love the humility that you're bringing to this conversation. And, Lee and I can go back into the time machine and remember when you were announced in this role. And I remember that time period, 10 years ago, NAATP was a different organization at that time. And is it fair to say that at that moment things were not going great?
Well, yeah, I think it is fair to say that. NAATP is now in its 47th year. We've really kind of grown up with the field, and organizations have ebbs and flows in their efficacy. And it was an ebb down. Yeah, things weren't good. Leadership there were a couple of problems, in terms of operations. But what I'll tell you is that the reason for NAATP's existence was always there. And a core group of supporters, the board of directors, never abandoned the mission. And after some difficulties, NAATP's brand probably fell off the radar to a large extent for some people. They were devoted to figuring out how to rebuild the staff, rebuild the association, and when I was hired, I was given all the tools I needed. I was given all the tools I needed in terms of sort of physical tools, but I was also given the support. I'll say love and support to do the work that needed to happen. And part of the resurrection, that sounds a little profound. I don't. That's
Phoenix ashes.
Yeah, that kind of thing.
Well, it is post-Easter now.
Yeah,
It's on your mind.
It's like, yeah. I got all kinds of things to say about that.
Or are you trying to say something else about, are you the savior?
Yeah. Well, there have been times in my life where I thought that, and that actually it's funny that you should mention that, because grandiosity is a part of the condition of addiction.
Mm-hmm.
All right, I'll reveal way more than I intended to, because you went sideways on me.
We have a tendency to do that.
Yeah.
Zine, are you taking notes?
We might end up talking about fish at some point here, but when I went to treatment, I didn't know anything about this business. I didn't know anything about Alcoholics Anonymous. I didn't know anything about substance use disorder. I knew I was pissed and I didn't want to be there. I knew that what's happening wasn't my fault. It was everybody else's fault. That's typical. I wasn't unique in that respect. But I was given 2 pamphlets to read to get me started. And those pamphlets, the one pamphlet was called Grandiosity, and the other was called Perfectionism. And it turns out, I'm not the only one, but they had my number coming in. So grandiosity is obvious. You see yourself as inaccurately and as some sort of almost fictionalized character. And perfectionism isn't really what most people think about. Perfectionism is the notion that you are entirely defined by your product and you better get it right. Right? If I can't try this case, if I can't impress this person, if I can't write this perfect paper, if anything is imperfect, there's something fundamentally wrong with me. And this is a condition that many people who suffer from a substance use disorder have. And so, not a Christ complex so much, but dangerously close, probably. Yeah.
Well, I love the story, and I love your humility too. And do you find it now, like with the work you're doing, does it take it more from like a professional to more of a personal mission?
I'm really careful with that, because I honestly think that our field is wonderful and it's populated by wonderful people. But to the extent that we have not gotten where we need to be as a field, that is to say professional health care, that concept of it's not a job, it's my life's calling is problematic, right? That's not how professionals function. It's not that you can't love what you do. I think you need to be aligned with what you do. But this is a job. It's a very good job. It's an important job. And at the end of the day, I go, to be with my family, right? And so there's a thread that runs through our work that is well motivated, but it actually works counter to bringing this field to taking its rightful place at the seat of health care, which is that we exist somehow, substance use disorder exists somehow on the outskirts as this special calling for special people. And the answer is no. This is health care. It's a disease. It's a disease rooted in the brain with biological, psychological, and social and spiritual ramifications, and we need to treat it as such. Now, how does the piece that you mentioned come into play? Well, my lived experience matters. My lived experience informs my decision. So does my law degree, right? So does my training as a business person. All of those things inform it. Being sober doesn't qualify me to do anything except not drink, right? And in the early days of treatment, it followed the social, like this all begins with a social model of Alcoholics Anonymous in the 1930s. So if you think of other areas of medicine, they come out of medicine. There's a medical proposition, and it builds and it builds and it builds. This field does not come out of medicine. It comes out of a social program, and it needs to be institutionalized, that not in the pejorative sense, but it needs to be institutionalized in a professional setting, and we've been on this journey from social program to institutionalized social program to professional medicine for 100 years almost. And now we're really getting close here, but it has to get here or people don't have access to quality care. We can't create access to quality care unless we exist within the healthcare system, not that it's perfect, but it's the one that we've got, and that we are on par with other medical and surgical disorders.
You know, that reminds me of conversations that I had. First of all, I love the way you frame that, and it just feels really in sync to the way that I think all of us kind of view the work, because I've said numerous times, and I can go back to almost a decade ago saying, if this industry wants to move from the kids' table to the adults' table, science needs to have a seat at that table. Right?
Follow the science.
And it's like, and that's the way I've always framed it to people. And it's like, it wasn't as well received as you might think.
No.
So
tell me about it.
So what was your experience with actually trying to share that message?
Yeah. Well, I wasn't ever, part of another part of having this condition is that you want everybody to love you. And, people say, I don't care what other people think about me. I've never said that. I care deeply about what other people think about me. And I think anybody who's saying that is trying to convince themselves of something. But no, I was not popular with that message. That has been my message. This is not a cult. Now, here's the thing. People say, oh, great, we got some guy that doesn't believe in the 12 steps. Hell no, that's not true. The 12 steps are one of the most exceptional ways to treat this disease. And 12-step facilitation, which is what we call it in the treatment context, works. It doesn't work for everybody. It's one thing that works. So when you say that this isn't well received, and it isn't, people misapply that and say, well, you don't believe in the spiritual process, right. You don't believe in the transformation of a human being. That's not what we're saying. It's biological, psychological, social, and spiritual. We got to hit all of those. So I would say, and here's an area where that comes into play, medication, pharmacology. We have wonderful pharmacology now that is best practice, that is gold standard in some areas. Not to use it is to not follow best practice. But we still have, I'll just say it, fundamentalists who will say, you can't take a pill to cure addiction. Well, that's not exactly what we're saying. We're saying we're going to address all those components, and this is a brain disease. We can see it in the brain, right? It is a disease centered in the brain. So we have to do all those things, and I think that the field, I know that the field is responding well. And how do we ultimately know that? We got to measure what happens. We got to measure outcomes. If you have a diabetes treatment and people don't get well, you don't use that anymore, and the insurance company doesn't pay for it anymore, and nor should they. So we've got to do. It's harder to measure behavioral health. It's harder to measure mental health and substance use disorder, but wellness is measurable. Wellness is measurable. Not just you can see, you know it when you see it. You kind of do know it when you see it. But if we can't measure it, it doesn't exist. And we can't prove it, we can't create policy around it. And so that's been my team's mission since I came in. And I would say that initially I wasn't the most popular guy.
Well, all of those things are true. And if you want to receive reimbursement for the services that you provide, again, kids table to adult table. It's like we need to be seen in the broader healthcare field as opposed to this sliver of, like you said, this comes more from a social movement as opposed to one rooted in medicine and science.
And we don't need to lose anything in the proposition.
Right.
We bring along all the things.
You bring along all the magic that comes with that.
Yeah.
And the added benefit is that we can prove it.
Yeah. Yeah.
Marvin, I wanted to ask you, last year, and a lot of people are in town this week for RX Summit.
Yeah.
And so last year I attended RX Summit and I got to hear RFK address the audience.
Yeah.
And he shared his personal story, of his relationship with AA, and it was really an amazing speech. I think a lot of people went in there thinking that they were going to be booing him, and they ended up applauding him. Has there been any progress in policy discussions now that we have a secretary that is committed to 12-step recovery programs? And if we haven't, what can we do to try to help affect some of these policy changes? Because I feel like we have a supporter there.
People are more than one thing, is what I would say. And I would say the secretary's recovery, personal journey, life experience is wonderful, authentic, inspiring, and is one of the pieces to the puzzle that put us in a place where stigma can be taken away, right? So I would say that the secretary's presence and his authenticity about his own illness and recovery really helps with the stigma piece. Someone in a very lofty position is a person that's in recovery from this disease. So that piece is definitely there. I will say that I am concerned that the administration isn't following the science as I would like to see it, as many people would like to see it. We don't have to have an ideology, right? We don't. What do you believe? How about we don't care about what Marvin believes? How about we look at what the facts are? What produces recovery? What doesn't? What is the evidence? And I would like to see the administration, in addition to acknowledging the importance of all of this, to also acknowledge that there are many pathways to recovery. Disciplined 12-step is one of them. It's not the only one. Medication works, and some people need to stay on it for a long time in order to work their way toward recovery. And we need to search for the scientific and medically well-founded modalities that get people well. And I think that I'd like to see the administration move more in that direction, but I'm grateful for what they have done.
What's your recommendation, NAATP's recommendation to the individual providers? Like, I feel like a lot of times providers that we're not as active in lobbying our representatives, and so I feel like that's still a missed opportunity that we all have, and we all have to take personal responsibility for doing that.
Well, this might surprise you, but it takes money.
What? I'm sorry, are we breaking news?
to do that, yeah. Breaking news. In America, if you don't have something backed by money, or anywhere probably for that matter, it's not going to work. Well, so you're absolutely right. One of NAATP's primary tenets is public policy advocacy. Again, we don't have an ideology. We don't support Republicans. We don't support Democrats. We don't support independents. We support those who promote access to quality recovery. So policy advocacy is critical. There's not a lot happening right now. Frankly, I'd say we're a little bit stalled. We have an active public policy agenda. We have the only PAC in Washington, D.C., the NAATP PAC, Political Action Committee, specifically dedicated to good substance use disorder policy. Absolutely. One of the reasons that NAATP exists is because individual providers individually don't have a very powerful voice. In fact, they have a squeaky tiny little voice, right? It's not heard. But together, when NAATP goes to the Hill with the voice of 1,000 treatment centers, we have considerable power. We don't have the resources. The field doesn't have the resources that, for example, the insurance industry does. There's a reimbursement that we mentioned, third-party reimbursement. This is managed care. We live in a universe of managed care, and if you can't successfully execute managed care, fair reimbursement, you can't treat disease. So that's the pathway that we're on, and we make progress. But for example, the parity law, which has been in effect for a very long time now, is not enforced, and parity is still violated by some payers on a fairly regular basis. The Witt case out of California is a wonderful example of that. Not a wonderful outcome, but a wonderful example of that. And we have to. I tell our providers, I tell our payers that we got to do two things simultaneously. We've got to develop really strong collegial, professional relationships with our payer colleagues, and we've got to hold their feet to the fire when they're not complying. So I think that answers or addresses your question a little bit.
You know, Marvin, I mean, just hearing you speak, it's like I can only imagine the high standards that you had as a trial lawyer. And you came into this industry. I mean, guess what'd you see at NAATP? What'd you see in the industry that you felt like maybe we had to have some stronger standards here?
Yeah, professions have, well, let me say, first of all, good professions have good professional societies that, like, okay, I'm a lawyer, the American Bar Association, right? It doesn't tell lawyers necessarily what to do every day, but it creates a standard of professionalism and practice and best practice. And so that's what I saw NAATP had done for to a large extent, but could do a better job of. So, I don't want to belabor my own pathway to this position, but it really does inform where I come from. So I left the day-to-day practice of law and was a law professor and trainer for years, even when I was doing other things. I was a faculty for the National Institute for Trial Advocacy. You don't really learn to try cases in law school. You learn a law, but you have to learn to try cases elsewhere. And I began working with children and families in crisis. Much of that crisis was substances, right? And so what I found was that they needed lawyers, right? Children don't have a voice. Frequently, parents in those situations don't have a voice. And if we could professionalize a practice of law to provide representation for children and families, we would have created a voice for these voiceless and disempowered people in the court system. So I became the director of the National Association of Counsel for Children for 15 years, and we professionalized the practice of law for children and families. We went to the American Bar Association and had it designated as a legal specialty. Didn't exist before. We wrote a textbook on it, and we wrote core competencies. So then I went to treatment and got sober. And so then I'm saying, okay, what are we going to do now? So I wrote a couple of law books, and I began consulting with some treatment programs, and then I ended up taking a directorship at Harmony Foundation Treatment Center in Estes Park, Colorado, which happens to be one of the charter members of NAATP. And as I finished my work there, I said to the CEO one afternoon, I said, Dot, I think we've done what you wanted me to do here, and so I think it's time for me to move on. And she said, well, Marvin, the CEO position at NAATP is open. Right, here we are again. I'll tell you what, I have been privileged to be given opportunities so often. If I've done something right, I've said there's an opportunity. I'm gonna do that. I'm gonna try real hard to do that. The American deal, for success, the American success story, the proposition that we talk about handing to all people, it was handed to me. Right? I was given opportunity. I needed to take the opportunity and do my job. It works for me. It works for people like me. Upper middle class white males seem to do pretty well by and large in our society. So these opportunities kept coming. And so when Dot Dorman was her name, still is her name, said, this position is open, and I knew people on the board, I thought, holy cow, what I know about this profession is that it needs to have the same evolutionary professionalization that we worked on as lawyers in the child and family arena. So the proposition was transferable. It was obvious to me. People talk about people in my position as being visionaries. I don't know. Maybe some people are visionaries. I'm not a visionary. I just pay attention, right? And so I can see, well, that's what, I can see that that's what needs to be done. If you'll give me the resources, I would like to try to do that. And then I get to hire a team that makes it possible. I mean, I got to tell you, it's not self-deprecating when people say, "Man, you turned NAATP around." Well, first of all, NAATP didn't disappear. There was good, solid stuff there. But no, I did not. I mean, we did this as a team. I was given the resources to hire good people and say, "This is our objective. This is how we're going to do this. We all on board. Let's do this together. Let's get in the huddle and do this together." And so it happened as if the universe had planned it to happen. And it just needs some people to pay attention to do the work. And that doesn't mean you're a visionary. It means that your dad was a hard-working man at the Firestone store in Billings, Montana, who said to me on a regular basis, I don't know what you're going to do or how you're going to do it, but show up. Always show up. You can pretend to care, but you can't pretend to show up. And then my dad lived to 102, died a couple of years ago, and people asked me, like, what did you learn? And I said, my dad taught me that it's not grandiose, it's not spectacular, but really good human beings show up. Try to show up. Mm-hmm. In fact, don't try to show up. Always show up.
Yeah. So you mentioned the Bar Association, which, I mean, I think this is really interesting because, I mean, like great trade organizations, they provide sort of a cleansing function, right? Or it's like they set some guidelines and then they provide sort of a cleansing function to make sure that it's like if you're going to meet our standards, or it's like if you want to play the game, these are the standards we expect you to meet. I do know that when you joined NAATP, that was a pretty boiling issue at that point, and it's like, and so I'm curious. So I got a two-parter for you. So I'm curious, like, where do you feel like we are as an industry in terms of sort of the good guys, good gals, and then once that cleansing function is kind of in place, then what's the step towards actually growing the field? Do you feel like we're at that point, or where do you see NAATP as an organization? Where do you see the field?
I think we are at the point where that is happening. We are not at the point where it has happened, and I don't know how long busting through is going to take. But good people are working on it. So I was asked by a journalist one time, can an unscrupulous provider provide good care? That's a really interesting question. So I'm lying and cheating. Defrauding patients and insurance companies, but I've got counselors who are actually trying to help people get well. I suspect that the answer is no, right? Ultimately, I don't. It's poisonous. It's toxic and it runs through everything. And I think that we've seen that. The reason I raise that example is because you have to have both the substantive, objective criteria that a profession has, and you have to combine that with a values-based ethical code, and so if I would say the first and most important thing we have done as an association in the early part of the period I was given is creating an ethics code saying that you cannot be a NAATP member without following this. If you are a NAATP member and you don't follow it, we're going to kick you out, and we did. We removed 100 members and $100,000 in dues in my third year as CEO. That's not what you get a raise for, by the way, right? I mean, you're supposed to increase the membership, and so that was, I'm proud of that. I mean, we said we may have to get smaller to get better. We may even get hurt really bad by doing this, but we're going to do it. It has to be the right thing. You don't always get rewarded for doing the right thing, but we did. I testified at a congressional hearing in Congress at about the same time we were doing that, and NAATP's membership really hadn't started to grow again and succeed, and the staff's back home watching this hearing, and the phone started to ring. People wanted to. It's not a hype. It's not an example. It actually began to happen. People said, "I want to be part of this," and we didn't get smaller. We got bigger, and we got bigger with the right kind of providers. We got sued by providers who we didn't let in, and we had to fight off those lawsuits. I got to say, it was kind of. There's nothing nice about getting sued, but for a lawyer who kind of misses the legal part, I was like, this is kind of fun.
Kind of like the fight.
Yeah, kind of like the fight. Because lawyers fight pretty well for the most part, right? I mean, it's not personal. Mm-hmm. You take these positions and you try to get to a good resolution, and so. In any event, you got to combine the substantive quality practice standards, the public policy systemic pieces and do it in a values-based ethical environment. And when you can combine those things, we have something that we can make work. And it does work. People do get well. So many of us are examples of that. The last piece of that then is we got to prove it, how they got well, and that's why we do the outcomes work. Our Foundation for Recovery Science and Education, we started in 2020, right when COVID hit, we forged ahead, and it stayed intact. And so, those are all the pieces that go together. But without ethics, without doing it right, none of it works. I've had people call and say, "Marv, I'm going to start a treatment program, and I want to tell you I'm going to do it ethically." Hang up. I mean, who tells you they're going to do it ethically except the guy that's thinking about not doing it ethically, right? I mean, hey, by the way, it's nice to meet you. I'm not a liar, a cheat, and a thief. Well, maybe you are, because why are you telling me that?
Well, I will say is like, I thought it was pretty amazing watching this happen, because so here you are new into this role, and anyone in the industry knew that there were a lot of bad actors, and so what's your first move? It's like, hey, there's skunks in the woodpile. Guess what? We're going to get rid of the skunks, and then the skunks are going to fight back.
And it's us. They're going to fight back, but we're also acknowledging there's something wrong with us. Now, those are the bad actors. Those are the bad guys, but they're still part of us. So there was a segment who said, "Why are you doing this, Marvin?" I had a member say, "All I hear you talking about is the problems in the field. You're never congratulating us or holding us up." And I said, well, I don't know. I think that's a bit of an exaggeration.
Grandiosity again?
Yeah, what are you, my counselor? You got to do the first piece first, right? Let's clean up our house and have I'll just say, a moral high ground on which to stand, and then we can say, look at all the good guys. And that's the sequence in which we did it. First, we say, here's what you can't do, and then we build a quality assurance manual, a quality assurance guidebook, which is now in its second edition, that sets forth the core competencies of addiction treatment. And if you follow those, you're a good treatment provider, right? Ethically, which is actually one of them is ethics. By the way, there are 12 of them. Didn't plan it to be 12, but it worked out that way. Yeah, I'm not. I think I lost track of where I was going there.
Well, and I wanted to ask. This is interesting. We just had Ben Camp on, earlier this morning, and so now we've had back-to-back podcasts referencing the congressional testimony in 2018.
Jamie was on here. Yeah. Our board chair. She's great.
Well, no, not Jamie. Ben Camp from recovery.com.
Oh, okay, gotcha. Yeah.
And so in that conversation, and I wanted to ask you, in the testimony, AAC had made a comment that there were 300 NAATP members that were advertising on their site. So one question is, did you ever get the list of 300? Because I didn't believe it and still don't believe it. But a part of it is, Marvin, we're back to where we were 8 years ago. And that was the challenge I had for Ben today on the episode, was that, you may have to get smaller by adding an opt-out button, so that those of us that provide treatment where we can feel good about the site, because otherwise we feel held hostage when you scraped our data and our copyrighted photos and our videos and our content, and now you're competing with us. So where do you see on this marketing ethics side? Because I feel like we're right back to where we were 8, 9, 10 years ago.
Well, okay, how much time do we have on this one?
Well, Marvin, take as long.
Yeah. So I'm looking at one of the directors in our programs, Rodriguez, across the way. She just kind of got a big grin on her face, wondering how I'm going to answer this one. Well, first of all, let me say that I think those guys are trying to do a pretty good job. Right, there have been some really bad directories that are completely fraudulent. They're bad. That's not what those guys are building. And so I think that I would not say we're back there in their instance, nor would I say we're back there at all. But bad guys are really good at being bad guys, right? And they keep finding additional ways to
Skunks find the wood pile.
Skunks find the wood pile. And like, are you from the country? Is that how you come up with these things?
You know,
East Tennessee,
you know
baby.
you know what? Accent never went away.
Yeah, I thought you were English.
They sent him to California for a few years just to get rid of the accent, but now he's back here.
I'm back.
You know, we have something in common. Missoula, Montana, one of the greatest places on earth, where I went to law school.
Yeah, Marvin and I talked about
and
that.
This guy taught, and some of the great trout streams. All right. So, no, I think we've made tremendous progress in terms of ethical issues. I think that the marketing, there are several places in which ethics come into play, but one of the most predominantly abused is marketing. And it's terrible because people are at their most vulnerable, and they can't find what they're really looking for. Which, I'll just give ourselves a plug, the AID, the NAATP Addiction Industry Directory, is merely a listing of all of our members. They've qualified for membership. They're not prioritized. They're just listed as transparently as possible. Transparency is the key, right? What you see is what you get, and the deeper you look, the better that program looks. The deeper you dig into that website, the better the program looks. That's one of the tenets of finding a good program. So I would say that we've seen some backslide, and the point you raised with recovery.com is a good one. I think that let's not leave. If we're trying to get away from any sort of illegitimacy or corruption in a directory, let's get all the hell away from it and get rid of those pieces, because that is a thing. And no, I never saw 300.
Yeah.
A list of.
Well, and I told Ben, I said there's a lot of great things going on his site. But I was really hitting him. I think Mark and Jeff were like, okay, Lee, you've belabored the point enough. But I really think that there has to be, if you would add something like an opt-out, I don't think very many would opt out. I think people would see that as the ultimate trust. Okay, now I do. And then I was challenging him to help our industry.
Yeah.
Because, I see it every day with my clients where there are bad actors. And they set up a site, and they're advertising on branded names to avoid the legit scripts.
Yeah.
And I've done a lot of work with Nick and Jay over at Cumberland Heights, and then they get reported, and then they take it down.
Yep.
But then the next week they pop right back up.
Whack-a-mole.
And it's very frustrating, and Google knows this is going on, and Meta knows this is going on, and we can't get any result there.
Marvin, I would just say too to the. I thought Ben handled it very well. I thought he answered, and he's definitely, you can tell that he cares about the industry.
Yeah,
so,
yeah,
I mean,
I agree.
Yeah, he's somebody hopefully we can work with.
Yeah.
Totally.
So he did a great job handling all these really hard questions. And
Mark's worried that we're never going to get more people to join the podcast.
Oh, yeah. We'll have Lee on.
No.
Yeah.
We love it. It's, hey, you got to talk about hard issues and anything. And, like going back to, when you first started at NAATP, and it just shows the high standards that you had to have to be able to have the fortitude to let those programs go so that you could build the high standards that you have today with the directory. And it's, all vetted, all ethical,
You created the first ethics statement for marketing.
That's
there was nothing. Everybody's got one now, but nobody had it back then.
Yeah, we did. Yeah, we did, and it's in several iterations forward now. I think it's in maybe its fourth edition because we learn more things. But its core pieces are still the same. I think that when Google's in the business of making money, Google. That's what they do. They're there to make money. I got so many things I'd love to talk to you guys about. But AI. So we're here for there's this RX conference, but there's a corresponding conference across the hall for artificial intelligence, which is where I spent most of the day yesterday, and it's really fascinating because this really is, I believe, a before and after moment. This technology that we have right now is a before. I think there's this.
We don't get many inflection points, but it certainly feels like we're at one.
Right. I mean, the universe is a different place than it was before smartphones. I remember when one of my kids was in high school, and Lily is my daughter's name, and her friend Sarah came over, and she had an iPhone. and she tried to explain to me what it was, and I didn't understand it. I did how do you, what are you, idiot? How do you not understand what it is? The concept didn't exist. Well, the concept of AI as it exists now, and not just that. There's two forms of AI. One is a brilliant researcher, but the other one is a worker bee that you can teach to go out and do stuff. And so if you, I was telling Zena the other day that do you remember? It shows you what a dork I am. But do you remember Isaac Asimov's 3 laws of robotics? She's like, I don't know what you're talking about. So now I'm telling everybody about the 3 laws of robotics. But basically, you got to teach the robots correctly. If you tell AI, I'm stealing this from somebody yesterday, 4 times that the sun is blue, and 3 times that it's gold, the next person who asks it what color it is, it's going to tell them blue, because that's what it was taught to do. We've got to this technology piece, which is one of the places we really need to step up, and NAATP doesn't help guide the field at this point, is really a turning point. It's not going to be the same, and the reason I went there is websites are probably going to go away. I mean, the website, as we understand it, might not have a function because all you do is ask for the information.
It'll be a function just to feed the AI.
Right. Yeah,
function just to feed the AI.
Yeah.
But let me say another thing about Google. When we were in Texas for our conference in 2017, and everything was terrible. It was a mess. Google representatives came.
This is the one in Austin.
This is the one in Austin.
Yeah. I forgot the gentleman from Google's name, but he regretted being at that conference.
He did, and not too many people referred to him as a gentleman either. But so basically what they said at that time was, "Hey, we feel you, but we built a playground. You guys play badly on it. That's not our problem." Wow. Ouch. So a lot of advocates kept working on this. Next thing you know, we've got a New York Times expose on people dying, and Google is letting them die. And so all of a sudden, then we get a call, and literally get a call from Google that said, "Would you like to come to the campus? We could use your help developing a system of checks and balances to make sure that this works." So I was kind of excited to go to the Google campus because like magical place. It's not magical. You can take your dog to work there, but you don't ever get to go home. It's kind of the thing with those.
It is the company store.
Yeah,
it's we've been out there. It is pretty.
It's pretty cool. So, but anyway, they did adjust. They shut down AdWords entirely for a long period of time, and that was the highest paid AdWord. Addiction was the highest paid AdWord in the universe.
Them and locksmiths.
Them and locksmiths. Yeah, you remember. You remember all this stuff. Yeah, there's 2 fields that have been shut. Advertising been shut down. Locksmiths, bad guys breaking into people's houses, and addiction treatment providers. Yeah. And
it's only because roofers didn't have a lobbyist.
I don't know. The roofers who did my roof recently were pretty honorable, but. Yeah, so it's tough though because like we laugh about it, but it also hurts my soul that that's what people hear, right? So this business about we got to call ourselves out on this, but we have to make sure that people aren't scared of going to good treatment at the same time. It's hard. It's been tricky work, but in any event, Google did reach out, and then LegitScript comes in, and the LegitScript standards are essentially a borrow from the NAATP standards. Well, the LegitScript certification standards are ethical standards, but not exactly the same. And we've had a good relationship. We don't agree on everything that they do, but they've listened to us and improved things. So what had to happen again with a company like Google is that public opinion had to shift, and the New York Times and other papers, but that Times expose was the big one. About a month later, I got a call from a reporter at the Times of London saying, hey, is it, we heard you got AdWords shut down with. How'd you do that? And I said, well, I did that single-handedly, without anybody's help. No, I said, no, well, it took a village to do that, and here's what happened. And they took the same approach in the UK. Google shut them down for a while. So, You know what? I worked in child welfare for a long time, and child abuse didn't disappear, right? And I said to somebody who was a prominent person in the field one time, our mission is to end the cycle of child abuse, and we failed at it. And he said to me, Marvin, we haven't failed at it for that kid.
Right.
So
that's that starfish story, right?
Yeah.
The kid who's at the beach and he's down there throwing starfish back into the ocean. Somebody goes down to the kid and just like, why are you doing that? You can't save all the starfish. And he's like, well, I was able to save that one.
Yeah. What's interesting, and thank you for everything you do with the child welfare too. Just I'm on the board of Tennessee CASA.
Oh yeah,
soon
wonderful.
To be the president, and
that's
so
great.
it's a great organization, but man, it's so needed. And sounds like you were one of the early ones really leaning in. So we appreciate all you do, but. I was also going to say, you mentioned pulling out the iPhone. I remember the day Steve Jobs pulled out the iPhone.
Yeah.
And there's never been anything that's created the type of innovation that it has over the years that it's been there. But it's also created a lot of challenges. And, there's new service lines coming out today with treatment centers that's, the phone addiction, the screen time addiction, and also like gambling is huge now. And
Huge.
And it's based on like the ease of how easy it is to gamble, not just on gambling sites and sports, but like even trading stocks and whatnot, like how just the ease of that for people.
Yeah.
What do you, beyond those couple like trends, like what else are you seeing?
Well, what I think we know for sure is if there is a thing that harms, whether it's a substance or a practice, and you make it prevalent, more people will be harmed.
Yeah, we discussed that with Jamie Vink yesterday. Where the standard that we use in the industry that 10 people need treatment, one person finds it. The thing that we challenged and I think we solved or even addressed yesterday is, well, you know what? In the future, that 10 is going to get bigger.
Yeah. Gambling is a massive problem, and the country made it a problem. I love sports. I'm a sports guy. I played all the sports growing up, so I'm watching ESPN all the time. ESPN has done this to us.
Yeah.
It's fair to say.
That's my opinion.
It's fair to say.
Right? I can't.
Well, and it gets back
watch
to
anything
the
without
dollars.
Yeah.
I mean, all of a sudden when you come in and you can lobby and you have millions of dollars to throw, at the political process. I mean, they really greased it.
Yeah, I'm shocked at it sometimes because I like those guys. I like those reporters. I think they've done amazing things. Think about all the people of color and women that are broadcasters on ESPN now. That's progressive stuff. Watching the tournament, that the NCAA women's tournament is prevalent is a good thing. And then we've got how to gamble on this upcoming event, which is not just an advertisement though. That's their
training
commentary.
Yeah.
Right. And so we're going to do a session on gambling this year at our national conference in Florida in 3 weeks. It's just one session, but everybody's got to be ramping up on this. One of the things that we are have been moving forward. We used to just talk about co-occurring disorders, right? Do you treat co-occurring disorders? And mostly back in the day, what we meant by that was anxiety and depression that goes along with the substance use disorder. Well, that's part of it, but it's beyond that. And what we know about treating anything is that integrated care is the best care. Whatever you're treating the whole person is the best care. So if you've got gambling disorder, sex disorder, eating disorder, and a number of other issues, and we're not, and the trauma basically that goes with all that, and you're not paying attention to that, and you're just looking at trying to get an individual to become fully abstinent from the substance, they're not going to get well. So that's the piece that is growing. It's hard for small programs to integrate all of that. And what I would say about programs is we can have all different kinds of programs, right? Everybody doesn't have to be Johns Hopkins. Some, you can just be a small little clinic that does one thing and does it well. You need to be very transparent about what it is that you do. It needs to be legitimate. It needs to be evidence-based practice for that. And our position is that you need to either treat it, refer it out, or braid it, right? So everybody has the opportunity to look at the whole human and treat it, refer it out, or braid it. And we're seeing more of that happen because a 40-bed, $5 million gross annual revenue budget cannot develop an eating disorder program, a gambling disorder program, all of those things. Yeah. So that piece has to happen. People are complicated, and there are multiple primary diagnoses that are available. You can have a primary diagnosis of addiction and other primaries.
So we started the episode by saying NAATP is where the decisions get made, which I love. And if you haven't trademarked that yet, then I recommend you probably should. That being said,
we've done it for you, so
you
don't have to.
Yeah, appreciate that.
That being said, I'm curious, like in your mind, what decisions do you feel like are being made right now?
Well, decisions on what is best practice as it concerns pharmacology, right? We're on the cusp of saying, as to certain things, there's a gold standard of pharmacology that if you're not following, it's a problem. You don't get to do that anymore. So I think we have to have those standards. What we really want to do is create individualized treatment that is based on standardized protocol. So by standardizing a practice, you can get individuals the care that they need. What has been a difficulty for so many years is getting to the point where where we can assess a patient well enough to know what they need, right? It's not a one-size-fits-all model. So among the decisions that are being made right now is how do we really hone in on proper assessment? So, let's do ethics again for a minute. Body brokering, right? We know what body brokering is. A guy goes out and finds somebody who needs treatment, says, I can take care of you, we'll get you paid, and he gets paid for taking the body treatment. Totally illegal. Doesn't happen as much as it used to, still happens. Apart from just the hideousness of that, the fundamental problem with it is that, let's say he's even taking the person to good care. What care? That, maybe he doesn't have that. Right? There's no assessment whatsoever. Mm-hmm. And that's fed by this notion that addiction, that there's this thing called rehab.
It's universal.
Yeah. So I don't like the word rehab. Programs use it, but it doesn't mean anything, right? What level of substance use disorder do you have? If you have that, how does it coexist with these other pieces? And how do we integrate the care for all of that? Look, there are, according to SAMHSA, there are approximately 50 million Americans aged 12 or older who meet the criteria for a substance use disorder. Do 50 million people need to go to residential treatment? Hell no. Mm-hmm. Most people who have a substance disorder have it on a mild scale and can get well on their own or with a little bit of help. Well, but then there's a guy on this end of the spectrum that if you don't get him into treatment tomorrow, he's going to die. And so we've got to, the trying to do a better job of answering your question, what decisions need to be made. The fundamental decision needs to be made is what do people need? How do we assess it? And then how do we get you there? And then how do we get paid for it?
And provide some standardization around it.
Yeah, and standardization, Joe Lee at Hazelden, the CEO of Hazelden, Dr. Joe Lee, likes to say standardization produces good individualized care. And everybody doesn't quite hear that, but he's right. That's how it needs to be. A blood pressure cuff analogy, right? You go to the doctor. First thing they do is they weigh you first, with your shoes on, by the way, to make sure it makes you weigh even more. But the first thing they do is slap the blood pressure cuff on you, and that a whole bunch of metrics are going to follow from that, and we're not going to be able to treat your prostate cancer and not address your enormously high blood pressure because you're going to die before we get to that piece. So this field can never have a blood pressure cuff, but the analogy that we need to work towards something like that as a measurement tool is kind of a good concept. John Driscoll, I stole that one. I don't have an idea, but that I generated.
So John came up with the blood pressure cuff scenario?
Yeah,
okay.
There are no new ideas. We call it R&D, rip off and duplicate.
Yeah, there you go.
So you're very good at it.
Yeah. Sometimes you get to thinking you thought of it.
Yeah. You convince yourself. I was just going to ask, like you mentioned earlier, white men over 40, and I know on your board you have a couple, many strong female leaders that lead big organizations. what are you guys? What is NAATP doing to continue to lift up, females in this industry?
Well, we have a very unpopular program, it turns out, right now called Diversity, Equity, Inclusion, and Belonging. It's a program I'm very proud of. It's a program we haven't abandoned. But I'll also tell you it's a program I don't lead with because I don't want to get punched in the nose every time I talk. Yeah. I do think this is a tragedy that it is an Alcoholics Anonymous 12-step principle. That we acknowledge all human beings and accept them for who they are and bring them in. These are program principles that DEIB represents. It is our mission at NAATP to provide access to care. So somebody disagreeing with access to care? Because that's what our DEI program is providing access to care. It's also providing access to the people who run care. Right? And that means the BIPOC community, and it certainly means women. There are still far too many women in positions of authority in the field, but it's growing. We have it's tough because in order to be an NAATP board member, for the most part, you have to be the CEO of a licensed and accredited treatment program that's a NAATP member. Well, if there aren't any women in those positions, we can't put those women on the board. So we've done our job. No, we got to promote women in that context. And the way I'm thinking about it today, I've been thinking about this a lot lately, is I really think that what we need to do is begin just looking at this as a next gen program. We're aging out. A lot of the leaders in the field have aged out in the last few years without very good succession plans. Mm-hmm. So we need to be training the next generation, and clearly a piece of next gen is a huge piece of next gen means empowering women to be into those positions. Yeah. And so we're dedicated to doing that. We have a special session at the conference on that, and our current board chair is a woman. Those things. We try to make sure that people see her face because it matters. Look, it's like, you see young girls and women who become professional athletes talk about young girls can see, and a woman of color can see my face now and know that's possible. Mm-hmm. We need to do that, and so it takes active, dedicated practice to keep going on that because it's very easy to slide back into the privilege that anoints somebody like me. Treatment, I said the American proposition was really good for me. Treatment proposition is really good for me too, right? Addiction treatment in its origins were built for white males, white Christian males. Couldn't even conceive of something beyond that. So, we got work to do in terms of opening up our minds, and fundamentalism has no place. Sticking to principles is not fundamentalism. Fundamentalism is an ideology that keeps us from moving forward.
Yeah. Well, I enjoy that you talk about the women, but you also take it even further on the diversity that's required in this industry to be successful. So
yeah, there's a segment of our membership that's not crazy about that, about the program. I heard somebody say to one of our staff members recently when talking about having diversity within the organization, this is a quote, "We don't have to do that anymore." We don't have to do that anymore. So NAATP, who sets these standards, I haven't told them they don't have to do that anymore. We haven't told them that, but there is this notion that you can back off now. Mm-hmm. And programs, understandably, like ours, have to be careful, right? You don't want to pick a fight every day that you don't need. But we need to hold the line in terms of being dedicated to a decent proposition, which is to provide opportunity for everybody and provide recovery for everybody. Mm-hmm. That's all it is. That's all it means. Mm-hmm.
Well, Marvin, there's a lot you've taught us today. I mean, having high standards requires a lot of hard work. You've done the work. It's funny, the harder you work, the luckier you got in your career, right? And so that's a huge principle. But, beyond all the lessons already, is there anything maybe we haven't asked you that you think would be do we want to talk any about NAATP Nationals coming up? I know, great program.
Yeah, our 47th annual Addiction Treatment Leadership Conference is coming up in 3 weeks in Florida. It's titled Future Proofing Your Organization. Right? Katie, again, not something I thought of. Katie Strand, our Director of Operations, used the term one day. I was like, I love that. So it's future-proofing your organization, and then there's a parenthetical that comes after that. But the conference is structured around moving forward, analyzing your program from a future back lens. Not what do we think we might need to go toward. Let's sit down in the future for a minute and look back and see how we pull ourselves forward. I think and so that's the principle that's going to run through all of those sessions. And our conference was the only game in town, more or less, once upon a time, 47 years ago. Now there's a lot of competition, and people can't afford to go to all the conferences. Nor probably should they. There's work to do back at home. But we've had to say to ourselves, well, what is our niche, right, at NAATP? We can't be all things to all people. There's no need to duplicate some of the other conferences that are out there. Let's focus on this tight-knit community of leaders who come together and set policy. So that's really what the NAATP conference is about. And it's also, I say this to the attendees usually when I open the conference, which is actually this isn't just a conference, it's a meeting. It's the annual meeting of NAATP membership. Our board chair, Jamie Vink, will call the meeting to order at the beginning. That's different. We come together as a community of practitioners dedicated not only to best practice and access, but helping each other achieve that. That's a big deal, right? That's profound to me, right? And I see it happening. I see it happening in the meeting rooms, and I see it happening in the halls. There's no secret sauce. There's no. There's plenty of sick people to go around. So the idea that there is this conference that people travel to that is unique among the conferences because it is a place where like-minded, values-based, best practitioner providers come together to be together, support one another, and move the field as a whole forward. That's a very noble thing. And I think that's probably why I took this job.
Yeah. Well, thank you for all you do. Thanks to you and the team. You have a small but very mighty team.
Small but mighty.
At NAATP. And so we really appreciate everything you're doing for the industry and look forward to being a part of NAATP Nationals 2026 this year. So Thank you. And thank you all for joining us on this episode of MasterMined. On behalf of Jeff, Lee, and myself, thanks for tuning in today. If our discussion with Marvin sparked any ideas or interest or any questions that we could have him answer for you, please drop them in the comments and we'll get it right over and get it answered for you. Please also be sure to rate, review, and subscribe to our podcast channel so that we can get this message out to more people. Until next week, we'll see you on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.